Greetings from Hires and Associates. We are an independent insurance agency specializing in Medicare insurance policies. And in this presentation, we're going to talk about what to do when you are new to Medicare. When you're new to Medicare, the first thing you want to do is check on your health insurance work if it's available. You want to find out if you can stay on your group insurance plan. The magic number is 20. Most of the time, if you're under 20 employees, you're going to be forced out of your insurance plan. Over 20, you can stay on. So it's a good idea to talk to your HR department and also see what others in your situation have done. If you're able to stay on your plan, then it's wise to begin to compare costs. How much you're paying for your health insurance now, what your out-of-pocket expenses are should you get sick. You want to compare that to Medicare, what your out-of-pocket will be with Medicare in terms of your Medicare Part B premiums or any supplement, advantage, or prescription Part D plan you might choose. If you're forced out of your health insurance plan or you decide you want Medicare to become your primary and then you want to supplement it after that, then you want to enroll in Medicare Parts A and B. If you're not keeping your group health insurance or it's not available to you for some reason, then you'll need to enroll in Medicare Parts A and B. Most folks are enrolled in Medicare Part A automatically when they turn 65. It's almost always free, so that one is simple. Medicare Part B, you have to enroll in through Medicare.gov or by calling 1-800-MEDICARE. You can also do it by making an appointment at your local Social Security office. Medicare Part B and Social Security are sometimes intertwined. By that, Medicare Part B premiums for most folks are taken from their Social Security check. So if you started Social Security before age 65, that will occur automatically unless you tell them not to do it. But if you're delaying Social Security past age 65, then you'll need to pay your Medicare Part B premiums out of your own pocket, maybe by writing a check each month. After you've enrolled in Medicare Parts A and B, then it's a good idea to start researching your options. Ideally, you've enrolled in Medicare A and B and left yourself a couple of months to start looking at the various plans that are out there. In our opinion, it's always a good idea to contact an insurance agent who specializes in Medicare. These folks can be a wealth of information. These are folks like us here at Hires and Associates. You want to talk with your friends, see what they've chosen, see what plans are good in your area. You probably want to research both Medicare supplements and Medicare Advantage plans. They are very different. You can't have both. You also want to begin to learn the rules of Medicare and deadlines. If you don't meet certain deadlines, it can be difficult to purchase a plan. You can have monetary penalties. You can have time delays. Again, agents are very valuable in explaining the timeline of Medicare once you become eligible. Then ultimately you want to choose an insurance plan that fits your needs and budget. As you're researching your options, you'll see Medicare supplement plans are one of your two options. These are plans that are designed to truly supplement original Medicare A and B, and they'll fill in some or all of the gaps not covered by Medicare A and B. There are 10 plans available for purchase, plans A through N, and they each have varying amounts of coverage. There are variations of plans C and F. There are select plans. There's a high deductible plan F. We've done another presentation on this that you can see on our YouTube channel. And there are several carriers offering Medicare supplement coverage. These are not network-driven plans, so there's really no barrier to entry. That's why you'll see a lot of different companies, both small and large, offering Medicare supplements. Now, all Medicare supplement plans sold today do not cover prescription drug coverage. So these plans are sold separately. These are called prescription Part D plans. They are coupled with Medicare A and B. So if you choose a supplement, you're doing this. You're enrolling in Medicare A and B. You're purchasing a Medicare supplement, and then in all likelihood you're purchasing a prescription drug plan as well, and then those are all 4 parts. Then you are done. If you don't want a Medicare supplement, your other choice is to purchase a Medicare Advantage plan. These are private insurance plans that will pick up what Medicare Parts A and B cover and some of what they don't. You'll still pay your Medicare Part B premiums, and your Medicare Advantage plan can have a cost as well. These plans fill in some of the gaps, but typically have more in out-of-pocket exposure than your regular Medicare supplement like a Plan F or a Plan G or a Plan N. Out-of-pocket with Medicare Advantage plans usually around $3,500 a year up to $7,000 a year, depending on the plans that you are comfortable with and ultimately the one that you select. These are network-driven plans, so you want to use the doctors and hospitals in network, or at least a doctor that accepts the terms and conditions of your plan. So if you choose a Humana plan, you're using the Humana doctors. Same would hold true with Aetna, United Healthcare, Anthem Blue Cross Blue Shield. Most of these plans include prescription drug coverage, so that's not an additional cost. Not all of them do, so you'll want to talk to your agent to make sure you've got coverage there. Folks like these plans because they are less expensive than Medicare supplements, but the trade-off again is that you'll need to stay in network, and they typically have a little bit more in out-of-pocket exposure. When it comes to Medicare, it's very important to know your deadlines. Your open enrollment window is only for a few months. It includes the 3 months before your 65th birthday, the month of your 65th, and the 3 months after your 65th birthday. There's no medical underwriting necessary during your open enrollment window. There are no pre-existing condition clauses or waiting periods or anything of the sort, but if you miss your open enrollment window, medical underwriting can be necessary for certain plans like a Medicare supplement. There are penalties for late enrollment. So if you don't enroll in a prescription Part D plan and you wanted to, you can have a penalty, and that penalty is for life. If you don't enroll in Medicare Part B when you're supposed to, there can be a monetary penalty, and there can also be a 6-month time delay. So it's very important to know these windows of time by either talking with an agent or calling Medicare when you're getting close to 65 and you know that you're not going to be on your work insurance plan anymore. Finally, once you've elected Medicare as your primary insurance and you've chosen a Medicare supplement or Medicare Advantage plan, you'll know that there's an annual election period each year. This is not the same as open enrollment. So there are only some changes you can make during the annual election period. It runs from October 15th through December 7th each year. You can change prescription Part D plans. No questions asked. No medical underwriting. You can disenroll from or change a Medicare Advantage plan. You can go to a new Medicare Advantage plan or go back to original Medicare. Changes are effective January 1st of the next year, any changes that you make during the annual election period, but they usually do not affect Medicare supplements. By that I mean you cannot use the annual election period to change Medicare supplements without going through medical underwriting. No matter what time of the year it is, if you want to change your Medicare supplement, in most states you have to go through medical underwriting. And that brings us to the end of our presentation about what to do when you're new to Medicare. Again, we are Hires and Associates. We are an independent insurance agency. We offer Medicare supplements, Medicare Advantage plans, prescription Part D options all across the country. Give us a call or log on to our website, and we will be happy to explain your options to you. Thanks for watching.